Lynn briefly touched on this earlier. You all may have heard of a very widely publicized obstetric violence case that happened right here on Staten Island. In Northwell Health, Staten Island University Hospital, when doctors forced Rinat, Dray, a woman with decisional capacity, to undergo cesarean surgery against her will and without her consent, taking away her right to bodily autonomy and medical decision-making, which in fact means that the hospital did not see Rinat, Dray as a full person under the law. So Staten Island University Hospital's doctor did this using an unethical internal hospital policy called managing maternal refusals, which is just as awful as it sounds. And as the recently released report on violence against women from the United Nations in July states, when practiced without a woman's consent, cesarean surgeries may amount to gender-based violence against women and even torture. So Lynn, my question for you is, how common are internal hospital policies like this?
But to answer your question, I don't know how many hospitals have written policies that purport to authorize doctors to do immoral, unethical, and illegal things. We know that that happens frequently, and it makes it that much more insulting and that much worse. But the case that we're talking about is Rinat Dray is a woman from Brooklyn who is Hasidic. She wants to have lots of babies. She had 2, both by cesarean surgery. And she knew that if she had a 3rd cesarean, it would be very dangerous to ever have any more children. So she worked with her doctor and said, I want to have a trial of labor. I want to try to get this baby out vaginally. I'm not saying I won't do cesarean, but I would like to try to avoid it. And the American College of Obstetricians and Gynecologists and others say that it is not unreasonable to attempt a vaginal birth after 1 or more cesarean surgeries. She gets to the hospital and lo and behold, her doctor is not there. Another doctor who's been trained in the way other people have looks at her, finds out she's had previous cesareans, and this is my interpretation, freaks out and says, you must have cesarean surgery. And when she and her doula say, you're not telling us anything that shows us this baby is at risk, or I'm at risk right now, let me continue, my cervix is dilating, let me give this a try. It turned out the hospital had a written policy that said, if you believe the fetus is at risk, and there's no objective criteria for, there are criteria for that, but all the doctor has to say is, I think the baby, help me out here, what do they say? They say, I think the baby can come out there with it.
Or I often hear them say, your body can't do this.
So if the policy says, if a woman refuses, and you think the fetus is at risk, you can force her to have that surgery. And by the way, you don't even have to go to court to get a court order if you think it'll take too long. Just as long as 2 doctors and the hospital lawyer are notified, something like that. We can get you a copy of it. The state health department, years later, has now said that it violates the Patient Bill of Rights. The problem is that determination has not brought about justice for Rinat Dray, nor ensured the respect, dignity, and proper health care of other women in New York City or New York State. And what's fascinating is the hospital's lawyers, the doctor's lawyers, the arguments they're making are shocking. And frankly, at this point, the lower courts in New York are agreeing. And the kind of arguments they're making are, well, the Patient Bill of Rights doesn't say it includes pregnant women, so they're not covered by it, which requires notification and consent. The Department of Health apparently doesn't agree with that, but we have still not seen a new policy, nor has Northwell, which has 25 or 27 hospitals, responded to us thus far to tell us what their policies are in all of the other hospitals. The doctors wrote in the patient's record, patient has decisional capacity, we are overriding it. Now the problem for most women is they're not honest in their medical records, so challenging what happened is very, very hard, and it's hard to document what happened. Also, after you've gone through something like that, the first thing you don't want to do is call a lawyer or call an organization that's going to ask you to relive this and go through it. So it's very hard to get the documentation that's needed. So you don't have to have that explicit a policy for these to be the policies. I mean, if you have a policy that says you have to induce labor at 39 weeks, to me, that's the same thing. It is something in place that has nothing to do with an examination and evaluation of the woman herself or engagement with her about what she wants. And labor-inducing drugs cause a very painful labor and often speed it up and result in unnecessary cesarean because you're now in so much pain and so much stress because of the labor-inducing drugs that they want to get the baby out. So we are continuing to challenge and support the challenge that Rinat Dray has brought. But this happened 8 years ago. And so fighting for any civil rights, for any human rights, is a long-term battle and a very stressful one for people who are already very stressed out, which is why I'm so happy to see all of you here. And I'm sure Rinat would be very happy too.